Hi, we're here today to talk about a couple of different types of elective surgery. One is a C-section and one is a hysterectomy. These surgeries statistically seem to be very abused procedures. As far as a C-section goes, these days we tend to think of surgery as an easy fix for so many of our problems or concerns. We forget that surgery is a life-threatening procedure no matter how routine. Having a C-section means a longer recovery time, surgical risks such as infections, bleeding, and complications from anesthesia, including pneumonia. There is an increased risk of blood clots, a higher chance of needing an emergency hysterectomy, and a higher incidence of a return trip to the hospital. C-sections leave the mother open for damage to her bowels and bladder, to increase blood loss and a need for a blood transfusion, as well as a higher risk of maternal death. C-sections leave the babies at risk for a variety of infections. Babies who are delivered by C-section are placed in the neonatal care intensive unit more often and have more respiratory problems and a greater need for oxygen therapy than vaginally delivered babies. C-section babies are also at a higher risk for surgical cuts and complications of breastfeeding. In addition, these children have longer APGAR scores. APGAR stands for the Activity, Pulse, Grimace, Appearance, and Respiration, and is given to your baby immediately after birth, 5 minutes after birth, and 10 minutes after birth, if necessary. Infant mortality rates are also higher for voluntary C-section versus vaginal delivery. You might argue that my doctor told me it is necessary. It is understandable that you are depending on your doctor to tell you the truth. However, this is a major surgery and it is advisable to have a second opinion, especially if you're told prior to delivery that you're going to have a C-section. According to ParentingSquad.com, the report states that U.S. C-sections are at a high of 31%. Latin America's rate is at 35%. Convenience and the myth of complete safety contributes to the rates, but so does the healthcare industry incentive. Hospitals can't help but be motivated by the high payouts of the cesarean birth. The WHO study put the rate of hospitals motivated by money at over 60%. That's a quite staggering percentage. Now we'll talk about hysterectomies. Hysterectomy is the second most common significant operation performed on females inside the United States. The most common is cesarean section delivery, which we've already discussed. Every year, more than 600,000 women undergo a hysterectomy. Despite the fact that some progressive doctors claim that up to 90%, wow, 90% of hysterectomies are unnecessary. More conservative estimates put that number between 20 and 30%. Either way, that is a lot of women that may be having unnecessary hysterectomies. In case your decision to get a hysterectomy is an optional one, consider yourself fortunate. You may want to spend some time researching your options and figuring out what will be the best choice for you. The good news is that more and more options are becoming available